Carol, seeing you there. Thanks for joining us, Marilyn. And like I was saying before, if you can think of any other sort of topics that you can think of that would be helpful over the next few months, we're starting to look at the next few presentations we'd like to give. So if you have any topics or questions you'd like to know, we'd love to hear from you. Thanks, Harry. That's a great question, the balance and motor issues. Jim, nice to see you. All right, so we're just about to get started here in another minute, but definitely keep those questions coming in. It's great to see. All right, so welcome everyone. The topic for today is back pain and Parkinson's disease, how physical therapists and exercise can help. Just in the way of introduction, my name is Tim Nordahl. I am a physical therapist working with the APDA Rehab Resource and Referral Center. We're based out of the Center for Neuro Rehab at Boston University, Sargent College. If you're not following us already, we wanted to just leave our social media information here and our contact information. So we'd love to hear from you. We'd love to keep in touch, and just wanted to have that there for you. Just to go over what I'm hoping we can get through today, we're going to start by talking about the scope of the problem of back pain in general, and then we'll talk about it specifically with Parkinson's disease. We'll talk about which symptoms of Parkinson's seem to relate the most closely with back pain. And then most importantly, I'd really like to make sure that we all leave here with some ideas of kind of how you can start to work on your back pain. So just speaking about lower back pain generally, this is a very, very large problem, larger than some people might think. It's a leading cause of reduced activity and work absence. Estimates of a one-year incidence of any type of back pain range anywhere from 1.5 to 36% of the population. That, especially that higher end, is a really massive number. Due to the associated activity and work limitation associated with back pain, this is a huge societal and economic burden as well. Leads a lot of experts to actually describe it as an epidemic. We use the term chronic back pain to describe an episode of pain that takes longer than 3 months to resolve. And studies have shown that the proportion of back pain that is chronic is also increasing over time. Recurrence of back pain is fairly common. So when they've done research to follow people who have an episode of back pain, the amount of recurrence can be as high as 66%. And lastly, research also shows a link between fear, distress, and depression with both the severity and the length of a back pain episode. We've found that patients who expect a more complete recovery tend to take less time off from work in response to an episode of back pain and do better over time. And this suggests that back pain is a complex problem, and it's not just related only to like the severity of a muscle strain or a disc bulge or those sorts of problems you hear about all the time. Now that we've briefly touched on just how big of a problem that back pain is for our society at large, we come to the real questions at hand for people with Parkinson's disease. Does Parkinson's disease cause back pain? And if it doesn't cause, if it doesn't cause back pain, does it make your pain worse? I think a lot of times as both a clinician or maybe as a patient, we assume that there's a clear link between the Parkinson's disease and the back pain. It just seems to make sense. Surprisingly, there's not as much research as you would think on this topic, but I do want to cover the information that we do have from the studies that are out there. So several studies show that the prevalence of lower back pain in people with Parkinson's disease is higher than age-matched controls. And they've shown this comparing people with Parkinson's to their family members or caregivers or other patients coming in to see a neurology clinic. No matter how you look at it, across the board, back pain just seems to be more prevalent in people with Parkinson's disease. A number of studies have also looked at what sort of individual factors might be associated with higher levels of back pain. We see that increased age, increased depression, more rigidity, or the posture problems that can be associated with Parkinson's disease are also associated with more lower back pain. When we've looked at the types of activities that back pain tends to limit for people with Parkinson's disease, we found that it especially limits activities like standing, lifting, or sleeping. And you can imagine if standing is difficult, walking may also be quite challenged as well. There's another study from Japan, and they took people with Parkinson's disease and they underwent a neurological exam. So they had them do their normal Parkinson's clinical tests. And they went through a thorough, detailed examination of their back pain. And they asked them a lot of questions about sort of when their back pain was worse or not. And they found that the pain severity fluctuated with what we call motor complications. So this graph on the right is supposed to show what we would consider motor complications. I'm sure many or most of you watching are familiar with these terms, but just to kind of make sure everyone's on the same page, the area in purple reflects, when your medication levels have peaked and you have a lot of dopamine in your system from that. And you can sometimes develop an involuntary twisting movement, which we call dyskinesia. So the areas that are in purple are meant to reflect when you would have dyskinesia in relation to how much dopamine is in your system from your medications. The area in gray is supposed to represent when your medications have worn off or you're not getting as strong of a response from your medications. The interesting thing that they found in this particular study is many people with back pain actually reported that their pain got worse during either the dyskinesia times or the off times, or both. So there's definitely a clearer link for these particular patients with when their dopamine levels are fluctuating over the course of the day. And again, back pain is also associated with higher motor symptom severity, a lower activity level, and a lower quality of life. We also have some emerging neuroscience that suggests that Parkinson's disease can change how the brain feels pain in general. So some of the loss of dopamine can actually affect circuitry in your brain that can actually make pain feel worse or make you more likely to feel pain. There was a study out of the United Kingdom that looked at people with Parkinson's, and they asked them about all these different types of pain and went through some screening tests for altered sensation. They found that musculoskeletal and radicular pain were the most common types of pain that people with Parkinson's reported. Radicular pain refers to sort of shooting pain coming from the nerves in your arms or legs. And radicular pain can be common with back problems like sciatica, which is a term that many people are familiar with. They also found that 33% of the participants in this study had evidence of some altered nervous system processing of pain. So they might feel like if they're brushing a cloth over their skin, or if they're gently pricking them with a pinprick, they would have increased sensitivity to those motions, which really suggests that this is a more common problem than we might have thought earlier on. We're really looking forward over the next few years that as we learn more and more about this would help us kind of determine additional treatments that would help for your pain. For now, it's just important to realize that this is probably part of the problem for many people. So just to recap what we've gone over so far, first, back pain is a common problem for people with Parkinson's disease. It tends to especially limit things like standing, lifting, and sleeping. And when we've studied this, we've found that back pain is associated with higher age, depression, and motor symptom severity. It's also associated with lower activity level, rigidity, and postural impairments. And pain is complicated, so it involves both neurological and musculoskeletal processes. Next, I wanted to just cover, as a physical therapist, sort of where we could come in. So the process of physical therapy for back pain. Many of you might have already seen a physical therapist for your pain. But for those who maybe haven't or are used to seeing their physical therapist more for the Parkinson's symptoms, I wanted to cover a little bit about what our process would be for this. It's important for me to say that everyone has a unique situation and everyone is a little bit different. So it's really difficult to give you an individual diagnosis or great advice over a big conference like this. But I just think it would be helpful for you to know just how we think about back pain, more generally speaking. So the first thing that we would do if we meet someone with back pain is we would ask you questions and test things like your reflexes, basically trying to make sure you don't have signs of a more serious condition that would require more testing or evaluation, potentially at a hospital. Once we know that you're generally safe, we would begin by analyzing your ability to perform some of your usual activities and daily movements. And we're trying to figure out which of these movements or activities are affecting your pain. We can also test things like your muscle coordination, your flexibility, and your strength to determine what specific problem areas are contributing to your pain. Once we have a sense of what's causing the problem, once we have a sense of what's causing the problem, we then are able to provide you with a treatment plan that's designed just for you and the problem at hand. This really should involve plenty of exercise, possibly treatments like manual therapy or assisted stretching. But really broadly speaking, generally, we've found that an active approach that's really focused on exercise has been shown to be most effective. So now what can you do about your pain? I want to remind everyone that we've covered that impaired posture, rigidity, and reduced activity levels were associated with pain in those studies we talked about before. And keep in mind that these are modifiable risk factors. So these are definitely something that you can do something about, excuse me. So over on the right here, I have some pictures. I took these from the Be Active and Beyond booklet. And this is a free resource that the APDA has developed, and it's available to anyone on their website if you haven't downloaded it already. I picked these two examples. The top left is a stretch for spinal flexibility, and the exercise on the bottom is an exercise for tight hip flexors. So that's would help your posture over time. And these are just two examples of ways that you can help with flexibility and posture. In the exercise booklet, they also have some examples of strengthening exercises. So these are two exercises taken from the booklet that also show you how to develop some strength in the muscles that would help your core and help improve your posture. It's important to say that and acknowledge really that getting started while you're already in pain is really difficult. So feel free to seek help from your physical therapist and your neurologist if you're having trouble getting started. And lastly, just keep in mind that link with lower activity levels in general. So cardiovascular exercise is also really, really important. And if certain conditions can cause more back pain with standing and walking. So maybe it's worth thinking about, using an exercise bike, or can you do water exercises in a pool if that's safe for you? What are some ways of getting you started? So this is really where we can come in and give you an individualized assessment if you need the help. Speaking of which, I just wanted to have our contact information one more time. So this is the phone number to call for the APDA exercise helpline. You can call us or you can email us with your specific questions. We can even help you find a therapist in your area if that's something that you would need. Over on the left of this slide is a link for the APDA Be Active and Beyond booklet that I was referencing on the last page. So that's free and available to download for anyone on the APDA website. And lastly, I wanted to open up to your questions and see what we can help you with. Teresa, I see there were a lot of questions coming in.
And Tim, I just want to thank you so much for an excellent presentation on a topic that really is on a lot of people's minds. So that was excellent. And it's great that we have time to talk about different questions. And we have some coming through. And then also for anyone that does have a question, if you write to us in the chat or the question and answer section at the bottom of your screen, we'll try to get to as many as we can. Tim, can I start with a question that came to us a while ago? It says, I've been having back pain. Will a back brace help?
Yeah. So this is this is something that sometimes will be recommended, and it can help in certain situations. So this could come down to your individual basis. So I definitely want to make sure I'm encouraging you to ask questions if a back brace has been recommended to you before. Sometimes it's important though to make sure you're careful about just not using it all the time, because that can lead to some muscle weakness in your back. So there's always a balance of just making sure you have some way of keeping your muscles strong. If there's a particular exercise or activity, like if you're washing dishes and that's causing a ton of pain and you need to wear it for 15 minutes a day, I wouldn't want someone worried about wearing it for a short period of time. But there's just a lot of individual balancing there that has to be done. So it's a good question. It's a little bit dependent on your individual situation, but I want to make sure people are thinking about keeping their muscles strong at the same time.
Tim, thank you. Yes. And that kind of leads into another question that's come to us. And I think you touched upon it a little, but I know this is on everyone's mind. What exercises do you recommend to strengthen stomach muscles? And I think the person's asking because we know that the strengthening plan is kind of the long-term plan to manage back pain. So this question was strengthening exercise for stomach muscles.
Yeah. So there's definitely a lot of approaches to this. I might want to actually rewind a little bit on the slides here. So I really like exercises, exercises like this one in the top right. You think it's a leg exercise because you're holding onto the floor and you're raising your leg back. But because you have to kind of tighten your stomach muscles and hold yourself flat while you're doing it, you're working some strengthening in for the core as well. This can be difficult for some people, especially if it's difficult or unsafe for you to get up and down from the floor. I don't want you to think that this is the one exercise you can do. Many times I'll have people hold onto a countertop or a sturdy table and try to do a movement like this. Or a plank, if you've heard of that. But those types of stability exercises are nice because you're kind of making your different stomach muscles work together to hold yourself stable. I tend to prefer some exercises like that over things like sit-ups or those older fashioned exercises. Just because our stomach muscles and our core is really, those muscles are designed to work together to hold you stable while you move. So it's important to train the muscles like that.
Absolutely. And the booklet you mentioned, the Be Active and Beyond booklet, the nice thing about that is the pictures and the recommendations come out in different levels of difficulty. So your point is well made. An exercise can be done in different positions to challenge the level of difficulty for the muscles or release some of the difficulty.
Yeah.
We have a couple more questions coming to us, and this one is coming to us from Jim, and it's question is, when walking becomes a problem due to stiffness and pain, is it best to push further or stop and regroup? Kind of your thoughts on that.
Yeah. It's a great question because I think that one of the things I would want to do is sort of see how or why it's causing so much pain. Sometimes there are problems with like your hip flexibility that could add extra strain on your back as you're walking. There are sometimes things like that we can help with a lot. Or there could be just a funny posture while you're walking that could be fixed. So that's one thing I would want to say is that you might want to have someone actually watch you walk and see what we could modify about it. But the bigger question, I think, which could apply to everyone listening here is, it is okay to kind of take smaller breaks and kind of get as much walking done as you can and stop for a minute and regroup if you have to. You want to make sure that you're doing the right amount of exercise, that you're getting plenty of walking practice, but you don't want to need hours and hours to recover from going out from a walk. So there is a lot of balancing that you have to do with that. If it's really hard to walk, like I had said earlier, you can also try just an alternative way to get some regular cardiovascular exercise, because that's just so important too. And I know I've said this a lot, but just kind of having that individualized assessment might help quite a bit.
Absolutely. Tim, there's kind of a few questions that might go together. And this is a question a little bit maybe off the topic of exercise, but with pain that's going on and stiffness that's going on, what's your thought on sort of other ways to alleviate pain? Someone was mentioning massage or like heat, kind of like a moist heat. Sometimes I know I've personally recommended a little bit of a cold pack. I know our topic today is exercise, but general thoughts about these other types of ways to manage soreness or pain.
Right. I think there's definitely a good role for that. And, it's hard to say. There's not really like one best way of doing that has come out of the research. we're researching physical therapy programs, I will say that the exercise is really like kind of what should be the central focus of a treatment program. But things like moist heat or even kind of alternating between hot and cold can sometimes be effective. With backs, I would really recommend trying a little bit of both and seeing what works best for you. Massage can certainly help, but the goal there, I think, would be helping you reduce your pain in a given moment. It's tougher to know sort of what the long-term effects are, so it may be something that you have to kind of come back to get that pain relief again.
Yeah. I have another question coming to us from Ron, a question about what exercises might you recommend to avoid doing in order to manage back pain, or kind of any general thoughts like that?
Yeah, so that's good. It's a really good question, and it's tough to answer for everyone at the same time. I think some common problems we can find are a really forceful extension or flexion of the spine. Really doing that over and over again, especially with a lot of weight, can sometimes actually make you a little bit more stiff. So that's generally one of the other reasons that I like to recommend more of a stability focused exercise program where you're focusing more on like planking and the exercises that I had shown on the earlier slide.
Yeah,
that's a really good question. Yeah.
A couple other questions, perhaps a little bit related to different sports. Bruce asked the question, he plays a lot of golf and does do a lot of stretching. Any particular stretches, or it makes me wonder, if the different activity has a lot of rotation or movement like that, anything to suggest?
Yeah, I think that's a great question too, because is something we hear about all the time. I would really recommend making sure both your hips and your spine are flexible, because a lot of a good golf swing comes from the hip too. So you would want to make sure that you're staying on top of that and kind of making sure that you're stretching into that rotation and that you're not fighting a lot of stiffness every time you try to swing that club. So I think that's a really good question. I'm glad you brought that up.
Yes, yeah. And in the question and answer section, another question about it's a kind of paraphrase generally, if walking is painful, kind of how to get that sort of optimal gait pattern, that sort of quality movement that we're always recommending as physical therapists, so that kind of upright, tall posture, how to balance that if back pain is happening during walking.
Yeah, I think that's where that individual assessment and kind of watching, there might be some problems with the muscles that come from your hip, because a lot of those actually attach to your pelvis and your spine. So just making sure that when you're trying to make a corrected posture, you really want to make sure you've got the flexibility to stand upright without really straining things. So that's part of what we would want to look at with an individual assessment. But I think that's a kind of a fairly common pattern we see a good deal of, Teresa. I'm sure you might agree too.
Yeah.
So because of the way both your hip and your spine tend to work together, and many of those muscles that attach to your hip come from your spine, it's just important to make sure you're getting that individual assessment and keeping yourself flexible.
Tim, absolutely, of course. And it's something that's hard to address in a big group setting like this, but that individual assessment is going to very much start that plan that's going to work for whoever's having this issue with back pain. I think that answer kind of follows with another question that's come to us with, what are the best ways to improve my posture? And I think you've touched on a lot of this with the stretching program and the strengthening for the individual. Any other tips on best ways to improve posture?
Right. And I think one of the things that's kind of difficult about this is a few things happen with Parkinson's and your posture. So part of it is, your muscles might get stiffer and you have an imbalance of muscle tone with some of the muscles in the front of your body versus the back of your body. But the other problem too is sort of, and I'm sure a lot of people, this will sound familiar, is you can straighten up, but then when you start to not think about it or not focus on that, you might kind of find yourself coming forward again. That's kind of difficult. That, I would say, is probably the hardest part about posture, because it's just such a habit, and you have to really work at kind of finding ways of catching yourself starting to lean forward. You know, sometimes people will have their spouse or partner help them, you know, remember to straighten up, or they'll get used to trying to check themselves in a mirror as they walk by. There are a few devices I've seen too that are starting to get out there. I don't know if you've tried this with any of your patients, Teresa, but there are some devices now that will kind of vibrate or buzz if you start to lean forward. I think those might be interesting if you want to try that out, just to help you remind yourself to straighten up as you start to lean forward.
That's right.
We can really help with your muscle strength and your flexibility with exercise, but the habit part tends to be the harder thing to fix.
That's right. That's right. Tim, I think we're kind of winding down with the questions. I do want to mention a couple people were asking about TENS and Advil. And again, those things, it's hard to mention individually how that might work for someone. So again, we recommend that individual physical therapy assessment. And I just want to point out one more time that Be Active and Beyond book that Tim was mentioning, the link for that is in the chat. And that can also be found on the APDA website. Tim, I want to thank you so much for all the information and just the great discussion today. This was such an important topic.
Sure. Thanks, Teresa. Thanks, everyone, for joining us. I definitely hope everyone's leaving here with a few ideas of where to get started, but most importantly, just hope, you know, exercise can really help. I definitely appreciate it. Sometimes hard to know where to get started, but we'd be happy to help if we can, you know, on a one-on-one basis, or help you find a therapist in your area. But I definitely want you to have that hopeful message leaving today. If you can think of any other topics that might be helpful over the next few months, we'd love to get your feedback. So feel free to send that to us either in the chat section, or you can get in touch with us by email to let us know, you know, topics that might be helpful to cover in the future.
That's great, Tim. Thank you so much.
Oh, thanks, Teresa. Thanks, everyone, for joining.